I'm often connecting with families maybe before they have sought out any kind of traditional mental health services. And so when Jen asked me if I might suggest a topic for this class, my first thought was to think possibly about anxiety. And the reason is it's one of the most common issues that comes up. And it's so helpful to be able to have a frame and some kind of tips around like, how can we think about this together and how can we respond to it, to the anxiety together in order to try to help things move forward. And so I thought I would just share with you all today really kind of the spiel that I give every Friday in the Stoughton clinic to this larger Stoughton hospital talk. So I'm going to pull up some slides. I don't have a lot. This is not a real slide heavy conversation. So these are not real big information heavy slides, but really to just kind of guide the information. And then as Jen said, please put questions in the chat. I probably won't be able to see those, but Jen will. And as we get towards the end, you know, she can certainly help organize us. And I'm just really hoping we can have some time to talk together about what you've all heard. So just getting started here with the beginning, just a couple of like overview slides. The first thing I just want to say is that while some kids show up as being worriers, and it's pretty obvious that they're worriers, kind of like how they came out of the womb, parents often will say, anxiety oftentimes shows up in kids and teenagers as looking like something else. And so this is this great slide I took right off of the internet from GoZen because I think it summarizes a lot of what we see. You know, that maybe a family is struggling because a kiddo is showing up with a lot of anger, a lot of fight or flight kind of responses coming out as anger. And we're going to learn tonight a little bit about why that is. Or they can't sleep. Sleep is a time we have to be able to lower sort of that physiological activation. We have to be able to bring the stress down and relax. So that can be tough. And it's also a point of major separation, especially for younger kids. So it can be kind of scary. Defiant kids, these are the ones that come in and it's, you know, there's all these kind of refusals and it's often around transitions and getting started with things and all this pushback and need for control. Really what that is about is it's hard to push through to do something that feels overwhelming and to feel like you don't have control in those moments, and it comes out as behavior. Chandeliering is the kid who seems to be going along kind of just fine, and then all of a sudden kind of melts, and it comes as a big surprise because they didn't know there was all this tension that they were carrying along. Lack of focus, it's obviously hard to concentrate when you're anxious. Avoidance, that's a huge one, and we're going to come back to that a couple times here tonight, which is basically, you know, when we're scared of something, it makes a whole lot of sense on some level to move away from it, to run, to get away from danger per se. But when we're scared of things like going to school or getting in the swimming pool or going on a play date to someone's house that we're not as comfortable with, you know, then you can see kids get into a lot of refusals around just doing kind of normative kid stuff. Over planning, and I would also add over studying for teenagers who tend to have like perfectionistic tendencies and worrying that, oh my gosh, have I done enough? And it turns out they've probably done more than they needed to. And just negativity, you know, it says right on here, people with anxiety tend to experience negative thoughts at a much greater intensity than positive ones. So it's kind of hearing that like, this is going to be terrible and no one's going to like me. I'm going to fail the test and on and on and on. I gotta say one more thing that's not on here that I really wish had been on this slide. What we call in the medical field somatic concerns, which is like stomach aches and headaches. And in a few minutes, we're going to talk a little bit about also why that is, because it's helpful for kids to understand that. It doesn't necessarily mean that they're sick, but we can certainly feel our anxiety, especially in the gut. So one more kind of just general information slide here, and that's just really to show that, you know, anxiety is kind of, I always think of it as an umbrella. This shows it as a wheel where at the hub we have that the word anxiety disorder. That there's all kinds of different manifestations of anxiety. And about 7% of all kids actually have and kids and teens, so I say like 0 to 18, actually have an anxiety disorder. That you kind of have to meet a pretty big threshold to have a disorder. But lots of kids and youth and grown-ups have anxious symptoms, and sometimes you can kind of see where they fall on this wheel. So, the social anxiety, going to the right there, at least for me, the generalized anxiety is like, I worry about just lots of different things, and then I have a lot of trouble relaxing my body, and I feel a lot of aches and pains. We can have phobias like being fear of heights, which would be me. Lots of kids coming into pediatrics, fears of injections, things like that. Obsessive compulsive disorder, I do want to say just kind of a special word about that. And I'm going to come back to that. I hope I remember too, and we can talk in the chat at the end if it's helpful. But this is one where, you might have some worries that go around and around, but then you have some actions or behaviors that you're doing over and over to try to help your mind settle. And there's some particular ways in which that shows up with kids that may look different than like what we see in the movies, which is often hand washing or trying not to step on a crack or something. PTSD, it's a little hard to read that in the red bubble, which clearly comes from having experienced overwhelming trauma events externally. It's actually not considered technically an anxiety disorder anymore. And in the way that they sort diagnoses, which I actually think is a big mistake, because there's just an incredible amount of anxiety that goes with PTSD and fearing kind of like that the next shoe is going to fall and that another terrible thing is going to happen. A lot of hypervigilance and easily to startle and things like that. And then panic, which is when anxiety gets so elevated. And with or without agoraphobia means some people start to fear going out, even of their homes at all, because they're fearful that they'll have a panic attack. I just wanted to say there, and a little reminder on the screen for me, that people will often ask like, gosh, well, I'm an anxious parent. Did I cause this because my child has been watching me worry? And one of the things that we know about anxiety disorder, that this also has to do with wiring. We are born, certainly to some degree with all of these, but certain ones more than others, like OCD definitely, with vulnerabilities in terms of our neurobiology. And so most likely in most cases, if you've got a kiddo in your life who's wired towards a lot of anxiety, they probably came to you that way. And even with PTSD, we even know that our wiring and our biology plays a role in whether or not a traumatic event will lead to PTSD symptoms or not, which is why now they treat soldiers in the field with certain medications to kind of reduce their reactivity after combat, in the hopes that they can prevent the development of PTSD down the line for those who are the most vulnerable. The other thing I just want to say on the front end here is that prevention matters. So you might have a kiddo in your life who's really struggling at this point, and you might have a kiddo who's just showing some tendencies. And we can't prevent things from flourishing in our kids that are difficult, but we can equip them with an understanding and some skills as a child and as a family together to kind of figure out how do we manage this. And for a lot of kids, that makes an enormous difference in terms of how big this is in their day-to-day life. So let's talk about the helpful tips about maybe what you can do and what you can take away. I've got 9 of these tonight. I was kind of hoping it would even out at 10, but it landed on 9. So that's where we are. And I realized I wrote helpful bits. I've been watching a lot of British baking show and gardening shows during the pandemic. So I think a helpful bit has probably come from that, hearing those shows throughout these months. But the first helpful bit, and I draw stick figures left and right with kids who are in the pediatric clinic with worries about anxiety, is this idea that if we can frame it, you can tame it. Like if we can understand what I'm feeling in my body, and we can start to put words to that, like, oh, hey, that's anxiety versus, I have the flu, because I have a stomach ache. That is actually the first step in terms of helping a kid kind of settle themselves, is that we kind of have to know what we're looking for. And, we know at this point that when the part of our brain that's in charge of feelings and emotions is like really lighting up, like if there was a lot of anxiety, a lot of worry going on, whenever we can use language to label what's happening, we know that the language center lights up, and actually that starts to lower the reactivity in the emotion centers. So some of this is just about starting to name what we see. But rather than writing, if you can name it, you can tame it, I wrote frame it, because we want to kind of frame the whole picture here on the front end of our conversation. And what I would normally do is I'd have my chalk or my pen, and I would draw a stick figure, with kind of a worried face. And I would first draw the thought bubble that I have there, that's up in the corner, where this particular worry person is thinking, oh no, what if? And what we talk about is that when we're feeling anxious, we have these oh no thoughts. And we never say, oh no to something good. We never say it like, oh no, it's Saturday. What if I get to watch cartoons and eat sugar cereal all day with my, my brother, which sounds great. We are always anticipating a future event in the negative. So, oh no, school today. What if nobody wants to play with me? What if I fail my history test? I could be walking down the street and see a dog. Oh no, a huge dog, what if it bites me? I mean, this could kind of be anything. And it really just depends on the person who's having the anxious thought. But what happens is really important is that arrow that's kind of pointing down and over to the body. Is that when we have an oh no thought, there are these messages that are sent down into our body just at like lightning speed. And many of you probably know about the fight or flight response. And so, we can talk to kids about like a much more extreme worry to help them understand this. Like, for example, if we're in the clinic together and, if I said, gosh, what if the fire alarm went off right here and those sprinklers start coming down on our heads? Our brains are smart. And they would say, oh no, the fire sprinklers and alarm are going off. What if there's a fire, right? And then we can say, like, what would you do? And kids have all these ideas about what we would do. And, hopefully we get to the one that's like, we get up and we move, we go out the fire exit, which is right next to where we're sitting. But the point is that we need to act. And so this message that goes down to the body that often gets termed fight or flight is really for our survival. It doesn't make any sense for us to sit there and think about all the things we know about fire, and just wait until the doorknob gets really hot and the smoke starts to come underneath the door. I mean, the kids will laugh and like, no, we're not going to do that. What we have to do is fight or flight. So fight might be we go and we grab the fire extinguisher, and maybe one of the grownups in this room is going to fight the fire. But flight would be like, we're going to get out of here. And that means we have to get our muscles kind of springy and ready to go. We can't just sit here all relaxed. So either way, we got to get ready to move. And that's a good thing because we're going to all be outside and we're going to be safe from the fire. And kids get that. The other arrow goes the other way. You can kind of see that it's pointing down and it's also pointing up. When it's going back up, the body's sending the message to the brain like, hey, we're ready down here. My heart rate has gone up and I'm pumping blood out to the muscles so they get oxygen so they can be springy, ready to run. And we're watching for danger. Some of the other things that happen are like respiration. We breathe kind of really fast and then we get outside, we're safe and we go, whew. We take that nice big breath that gets oxygen to the brain. When we get outside, we might notice that we're shaky. That's because the blood pressure has been up. And if we stay this way for very long, we might realize we've gotten hot because the blood pressure. Like all these things are good. The message going back up to the brain is we're ready to run or fight the fire. So brain, you keep watching for danger. And this is what's happening no matter what a kid is worrying about. If they're worrying about the history test, They might not feel the thump of the heart in the chest, but it's elevated a little. The muscle tension's elevated a little. The respiration is not great. And the problem here is feedback loop keeps sending the message to the brain saying, yeah, keep watching for all the things that are going to go wrong with this history test or this day. The other problem is the history test isn't until 3 o'clock. And we're not going to get outside from the fire alarm and get to relax quickly. Going to be in this level of tension all day. And so when that happens, you see the little red lines on my stick figure with that elevation in muscle tension, elevations in blood pressure, things like that. You're going to be more prone to get things like headaches. The other thing is our body is so smart that we actually have more neurons for anxiety in our gut than we do actually in our cranium, which is interesting. But our smart bodies aren't going to bother with things like the regulation of digestion when we're trying to survive a fire or a history test. So that's where you get kids who have stomach aches and digestion is not sort of operating as it should, and things get backed up or they go too fast. So we get kids who feel sick, we get kids with diarrhea. I get kids who then get into a feedback loop of, oh no, what if I throw up? What if I'm sick? And all those pieces can kind of get into the loop here. So the very first thing we want to be able to do for kids is teach them. You have an oh no, what if? And then you have all these reactions in your body. So that as you observe that as they're grown-ups, that we can start to say things like, I think I hear an oh no, or your body's looking tense, so that they can really start to begin to understand that, oh, that's anxiety. The next thing I want to just mention here is that this is really hard to do with kids when we as adults are not feeling calm in our own minds and our own bodies, right? So that first slide we looked at where we have the kids who are, spouting out with anger and defiance and chandeliering and they can't sleep and you can't go to sleep as a result. And all of these things, it raises our own stress levels. It raises our own anxiety, it raises our own anger at times. And if you look back, I just want to say one more thing about the stick figure. Heart rate, muscle tension, respiration, all those changes are the same things you feel when you're angry. This is why kids kind of fly off the handle and look mad instead of anxious all of the time. Not all of the time, but some of the time with anxiety. But if we're doing stick figure guide together, of course, we're just going to keep escalating each other. And so one of the things we think a lot about is, as the adults, there's that expression, put on your own oxygen mask first and then provide assistance to your child. We are no good to the kids in our lives unless we're kind of able to bring our own system down and kind of get regulated and calm in our own space. And when we can't, that's okay. We're human beings, but it's maybe not the time to be able to come alongside an anxious kid as effectively. The third thing I just want to mention is what we call filling the tank. And as the adults in your kiddos' lives, you have some control over this. I realize there might be teenage parents on the call here who have less than some of the other parents and caregivers. But by filling the tank, I mean we always talk with kids about, anxiety is tiring. It wears you out. Takes a lot of mental energy. It takes a lot of physical energy. So you're going to need as much fuel in the tank as possible. The number one thing that we're thinking about is sleep. And you might be sitting there thinking, yeah, but she put sleep on that first slide and kids who are anxious sometimes can't sleep. So how do we get enough sleep in order to get through the day and be able to manage the feelings a little bit better? And that is an excellent point. If you're having that in your mind, and a lot of times we do have to think very creatively about how to bring anxiety down at bedtime in order to get more sleep. Because whenever we're better rested, we actually manage a whole range of emotions better. Anxiety is just one of them. We also have better frustration tolerance. kids are better able to even manage their excitability without being as maybe wild and impulsive and things like that. So the sleep part is really important. My little pediatric clinic plug here would be is kids don't need 8 hours of sleep. Most of you probably know that, but you can look it up online. The younger the child, the more sleep they need, but even teens, are really in that 9 to 10 hour range still before adulthood. And the other way I think about filling the tank is nutrition. The biggest thing I think about, especially for kids who are kind of anxious going out into the day, is trying to avoid blood sugar crashes. Like, can we get some protein on board, kind of help carry your energy a little bit more consistently as you're moving out to your school day or your swim lesson or whatever that is, so you can just feel a little bit more steady. There's, of course, also lots of information out there in the world about other like supplementation and things that can help as well, and antioxidant rich foods, that sort of thing. But a reasonably healthy diet, try to avoid sugar crashes. We try to get a lot of protein in and a lot of rest. I mentioned before with the stick figure worry person that we want to help raise kids' awareness of that, oh no, what if, that I'm having a worry. People who worry do it so often that they're not even often conscious of it. It's just kind of a subconscious thing. It's just like running like a script all the time. And we want to put a light on it, or a magnifying glass, as it shows in the picture here. And so one of the things I talk with families a lot about is, I want you to watch for oh no, what ifs. And it doesn't just to be with the kiddo that we're working to help. It could be with anybody. Mom has an oh no, grandma has an oh no. We want to start getting these out into the conversation. We want to start putting them into words, because you can have a kid maybe who's refusing to get in the car to go somewhere. But if we can start to put what is it that you're worried about? Let's try to find the words about what this is really about. Oh, what if I go to swimming lessons? Like, what if I drown? And then, now it's in words, and we heard that language kind of helps bring down that reactivity. And then it kind of gives us the opportunity to say, like, wow, that is a big worry. What do we know about this, swimming pool situation, or this possibility of drowning? One little trick I just want to make sure that I say here today too is, it's hard to watch our kids worry, right? It's hard to watch them be afraid. As adults, oftentimes what we want to do is reassure them. And there is something lovely and supportive about that. But if you have an anxious kid who tends to go with the worries, it won't help. And many of you probably have felt this, where you're telling your child, we go to swimming lessons every week, nobody drowns, this, things like that. And you want them to believe you, and it just seems to kind of bounce off of them. The reason for that is because the anxious brain only settles when it starts to speak to and reassure itself. And I think most adults can relate to this. If you can think of a time where you've been stressed and anxious about something, and then another adult, a partner, a friend says to you, or a coworker, yeah, it's not a big deal. It can kind of feel invalidating, or this idea of like, well, you don't get it. You don't understand like what I'm imagining in my head, or what I'm anticipating, or the possible outcomes here. So the trick for us as the adult supports the kids, as we try to become worry thought detectives together, is to get it into words. What's your oh no? And then what do you want to say to that buddy? Tell me what you know about what's there at the pool to make sure nobody drowns. Those kinds of things. I'm fully aware as I say this, that kids do sometimes have worries that the worst case is a really terrible worst case scenario. Sometimes there are real dangers in their lives. And so we're not always looking to say that's not going to happen or to help them say it. Sometimes we are looking to help them remember that they have support and coping skills, like, oh gosh, whenever the Stoughton School District does the drills for an active shooter, I will see kids in the pediatric clinic, generally young kids, who greatest worst case scenario is that a bad guy comes in and shoots my classroom up, my teacher. That would be terrible. So we have to be able to also kind of approach kids around hearing some of these things that are pretty disturbing, and then reminding them, what have you been learning? Who's there with you? One of the expressions we think a lot about is Mr. Rogers, who always said, look for the helpers, right? Who is there to be your helper? Because you'll have kids who say, but you can't tell me for sure, that will never happen. And technically you can't. We can get into statistics with older kids and like the likelihood and all that kind of stuff. But sometimes we just have to go, who is going to help you? Who can be there with you? Who can walk this with you? Or what do you know about when you've been in a really difficult or scary thing in the past? How were you able to help yourself? Even just taking a breath, depending on what the situation is. So I recognize this one can get tricky, but it is helpful to start watching for them together. And you can usually find in any family plenty of low grade ones, like, oh no, what if I forgot, to get milk at the grocery store? That's a worry thought. The next one is going back to our little stick figure person, is remember we had the oh no, what ifs up top on the head, but then we had all the body stuff, right? The body is responding, getting ready for danger. It's holding all this tension. So we can think with kids about, what do you want to do with all of that tension in your body, all that uncomfortableness? We think a lot about release or relax. Release is our little jump roping figure here, which is basically do something, get some energy out. Jump rope, run around in circles, do some jumping jacks. An older kid might go for a run. Little kids, even little things like, if I think we have some teachers on the line here, but like even little things that you see happen, like in classrooms, like there might be a place where there's hands on the wall, where you put your hands and you just push the wall as hard as you can, because we know that a small child can't push down a wall, but it's this great release of energy with some joint compression when we do that sort of thing. And then the relax part is, how do we kind of slow everything down? We talked about in that fight or flight response, there's this heart rate that's up. And one of the things we know is diaphragmatic breathing lowers your heart rate and your blood pressure. And that's the big fancy word for what all of the early childhood and educators and people who work with kids are doing now with like belly breaths or 5-count breaths, all these things. But the basic idea is a nice, long, slow inhale through the nose. And then we kind of hold it, and there's a nice, long exhale through the mouth. And we do that 3, 4, 5 times. Younger kids have a hard time coordinating that. They want to breathe with their mouths a lot. And so we'll do kind of playful, silly things, like sometimes even when we're not wearing masks, hold the lips shut, but we talk about not being a goldfish, not breathing with your mouth, but choosing your favorite smell and then blowing out your birthday candles. So if my favorite smell is Christmas trees, you might say, let's pretend we're breathing in Christmas trees. And then we're going to practice blowing out your 8 birthday candles. There's lots of ways to do this. The most important thing is that it's in through the nose and out through the mouth. There's also lots of other ways to work at relaxation in the body. We have a little image here that makes me think this person is in a yoga pose. Yoga is a fantastic kind of informal practice to be able to feel your body. Use yoga breath, which is definitely more slowed down and intentional. There are a lot of apps now where even kid-friendly apps that kind of walk your body through. Let's take in a deep breath, and maybe the circle's going around on the inhale and then it's going to a close on the exhale. I use the Calm app a lot, CALM. Lots of breathing exercises for kids. There are sleep stories for kids to kind of help them relax as they're going to bed. And there are some progressive relaxation exercises on apps like that where you learn sort of in a seated or a laying down position where you kind of learn, sometimes this is called a body scan, slightly different, but very similar, where you learn to kind of go from muscle group to just kind of check in. Am I holding any tightness like up in my shoulders? Haven't been at the computer all day, those sorts of things, and can I let that go? And we can intersperse those kind of body scan app practices as well with breath. Kids love this stuff, I find often. If we can set them up with an app or CD or something like that, and if families can do them together. But what I often will ask a family to do is to do this right before bed. This kind of the relaxed stuff. Maybe listen to the relaxation app even in bed, because we have to go to sleep anyways. So it's a good time. It gives an anxious brain also sometimes something to concentrate on. We can kind of make it a meditative exercise in the sense that you're going to listen to the voice, you're going to follow along with the voice. And when you realize that your brain went over here and started worrying about your history test, it's okay, but you're going to remind yourself to come back to the voice and follow along with what they're asking you to do in your body. Probably talk about this one all day. So I think I'll go to the next one, which is number 6. What I call the getting started hill, which is basically, if you are someone who knows about the language in the mindfulness world, it's noticing impermanence. And basically all that means is this too shall pass. When kids are having an uncomfortable feeling or emotion on board, like anxiety, it feels like it's never going to leave. And I would say that's true even more so with really young kids. They're like, I feel ick, and this is just how it is. They don't recognize that this feeling is going to shift over time. So one of the things we talk a lot about is, especially with kids who are having trouble around what was called avoidance earlier. I don't want to get started. I don't want to go to school. I'd rather stay home. I don't want to go to swimming lessons. I may not even want to get out of my comfort zone at home to even get in the car with you to go to the grocery store, because it just feels hard. It's kind of overwhelming. And those are situations a lot of times where kids can't even articulate the oh no. So we end up saying things like, oh no, Mom, let's go to the grocery store. Or like, what if I just feel uncomfortable? What if it's hard? And then we think about, like, you're that little face down there in the corner that's looking worried. And like, I'm looking up at this big mountain or this big hill of this thing I have to do. And really it's the experience of being overwhelmed. Like, what if it's just too much? But like once you get in the car and you start climbing up the hill, at some point you're probably going to get to that face on the top where you realize, like, oh, I guess I'm okay. Like swimming lessons might not be my favorite thing, but I'm here, and I might even have some fun, or at least it's almost over. And then as we're headed home, we go down the hill and we get to that face in the corner that's smiling and it's like thumbs up. And the idea there is like, you know what, now it's over. You get some relief. You did it. You might even feel proud of yourself if it was something hard, that we can celebrate that. For kids with school avoidance, especially older kids, they're often relieved that they didn't miss another day. because that gets you further behind, and they're already oftentimes in that cycle. And it's like, oh, at least I didn't get the, oh no, what if I have no idea what's going on, thought bubble bigger, even though it might have been pretty uncomfortable to be there. And so this is something we draw all the time with families. I find kids like to draw their own. They like to make them visually more attractive than what I'm capable of. And families put them on the refrigerator. And when you get that kiddo who's doing resistance, like, I don't want to, they have the ability to say things like, I feel like we're at the base of the getting started hill. Are we here right now? Is this like oh no, hard to get started kind of moment? And often that alone is helpful in shifting kids, because they're like, oh yeah, that's what it is, and I will feel better. It's not always that simple, but we have found that it is a helpful visual to just kind of frame things up a little bit further around the arc of how this is going to feel. Number 7 is practice approach. I've already been talking about avoidance. I don't want to go to school. I don't want to go to swimming lessons are the 2 examples that are coming up here. The problem is that if we don't ever do the things that we're worried about, then what we are teaching our brain is, okay, I stayed home, I was safe, I was comfortable. Good thing I didn't go, because it probably wouldn't have been tolerable. The less practice we have with something, the harder it feels, like the bigger that mountain feels. The more practice we have with something, the smaller the hill gets. It might still be there, but it gets a little smaller to travel. And so a lot of the work we're doing with anxious kiddos is thinking about with them. I'm all for like working with kids in collaboration. So like we have a scary thing, like, going to school, you have to kind of figure out with your kiddo a little bit about the Goldilocks dilemma, which is basically, if I force you into the car and I drop you at the curb and I don't come back till 4 o'clock, for some kids that's fine, but for some kids that's flooding, it's in the too much bowl. And they might just completely melt, they might completely shut down, or a whole range of other things. And then it becomes even harder to try again the next day. On the other end, we have the not enough. Okay, you can stay home one more time. And then that we get into that repetitive pattern. But the longer I stay in my comfort zone, the harder it is to climb the mountain. So we're looking for that middle space of the just right. Like, what can we do to kind of get out there and practice getting out there till you build some confidence, and then we'll take the next step. And it can kind of be like a ladder. I would rather see a kiddo, and this is all pre-COVID, of course, but I would rather see a kiddo get to school even just for the morning, just for an hour, than not go. I would rather see a kiddo get to the office and we have a plan that they'll go into the counselor's office, before they would do anything else, than stay home, as just a couple of examples. The swimming pool is kind of easy to think about that, right? If you throw them in the deep end, they're never going to want to go into the pool area ever again. It's too much. I got totally flooded in my system. But if we say, oh gosh, you're nervous about the pool, we'll never learn to swim, that's probably not enough. They're going to miss out on things that might not be safe. So we find the middle. How do we sit and watch the other kids? How do we get on the steps? How do we put our feet in? How do we go a little further? That sort of thing. Number 8, this one is really using the resources that are out there. I'm a huge fan of using books. There are so many. This is like 1% of the books that are fantastic out there about working with anxiety for kids. Starting from the left, I just put one that's really good for the youngest set, your pre-Kers, your kindergartners, A Little Spot of Anxiety. It's not the only one, but it's a good one. Then we move over to like Ruby Has a Worry, which is just, maybe early elementary school. What to do when you worry too much. This workbook in the middle with the tomato plant is for your kids who kind of hit that 7-year-old range. It's about 7 to 12. These are kids who are old enough to think about their thinking. they can think about like an oh no, oh, I'm observing my thought as an oh no, what if, whereas the younger kids, that's a little bit tougher. We might make a worry look more like it does on Ruby's cover there as like a little worry pest that's following her around, that kind of thing, make something concrete. And then at the far right there, at least it's the right for me, it's the Teen's Guide to Managing Anxiety and Panic. That's an oldie and a goodie. There are more contemporary ones now, but I still really like that one. And now there's just everything on YouTube. I just looked the other day with a teen on YouTube about things about anxiety, and like MTV has a whole channel called like Teen Code, and they have these great videos on anxiety. Sesame Street has a video on anxiety, and then like every character in between for the age range, you can usually find something pretty good. And these are just useful because it's sort of like all the stuff we've been talking about today, but in kind of a playful or a visual format that's not just mom or dad or grandpa or Dr. Hipke talking about this, but it's Elmo, and it's another teenager who looks like my age, who's working on the same thing. And oftentimes just having a little bit of space between myself and this information, I can see it in another person or in a character, that's really helpful. And then 9, the last one, is just that when you're feeling stuck, if it does feel like it's too much, like we're trying these things and we're not getting anywhere, that's a good indication that it might be time to get some additional help. And I chose this picture because right now most of the help looks like this on the computer. But a starting place is always good to check in with your family doctor. They often are a hub for some of the resources that might be out there in the mental health world. The two kind of arms of treatment oftentimes are cognitive behavioral therapy and related psychotherapies. Cognitive meaning the thoughts, the oh no's. Behavioral meaning how do I work with my body, and medication. And some kids need both. Some kids one or the other. My personal bias is, especially with youth, I would always prefer that a child not have medication unless they are also doing the therapy to learn the skills. Because the medication does make you feel better, and then you're like, I don't have any anxiety, and then you stop taking the medication and you have anxiety. So we need to do the skill building no matter what. And I say that with full ownership that I'm not a prescriber, I'm a psychologist, I'm the person that does the therapy. So obviously I believe in the therapy and the data is good. Of all the psychotherapy outcome research, the efficacy or the success for therapies treating certain conditions is probably higher in anxiety disorder than anything else. The stuff works.